Hi guys, and welcome to today's episode of the vlog series. Today we're going to talk to you about careers in acute medicine in the NHS. Okay, so we appreciate that acute medicine isn't always recognised as a specific specialism in every country's healthcare systems. Now, the good news is that it can attract a real breadth of applicants from overseas. So if you've got experience in emergency medicine, ER, medicine, internal medicine, ICU, critical care, all of those may be applicable to an acute medicine role in the NHS. Traditionally, people will come into it with their Royal College of Physicians examinations, so their MRCP 1, 2 and PACES, along with OET and IELTS, of course. Okay, so lots of doctors find a career in acute medicine in the NHS incredibly rewarding for a number of reasons. The first of which is the breadth of exposure that it gives you to different areas of medicine in the NHS, which is obviously going to equip you really well if you choose to subspecialise and go down a particular route in the future. Every doctor who comes through NHS training, so UK-based doctors, will have done core training for 2 years, a CT 1 and 2 level. And during that time, they'll rotate through several different areas of medicine before deciding eventually on their final chosen specialism and continuing to do another 3 or 4 years of training in that. So acute medicine, whilst it doesn't give you those particular rotations, it will give you a real breadth of exposure to cases from each and every one of those different specialities. And obviously that means that you're then linking in with all of those different departments, getting a great network of people to speak to in each and every one of those departments. So for future prospects, if you're planning to move into a subspeciality, it gives you a brilliant grounding, the start of a brilliant network as well, and obviously a really clear pathway to potentially going into future training or CSER in a particular chosen speciality. I think aside from that, there's also a huge number of jobs in acute medicine in the NHS. It's one of those areas that's spawned fairly recently. It used to be that doctors would be initially seeing patients in A&E and then they would send them straight to a particular medicine department. That now is kind of split off, so you have A&E and acute med depending on what you're presenting with as a case when you enter. There's lots and lots of vacancies out there, lots of roles for doctors who are coming into the NHS, and of course because they are willing to choose people from different specialities such as ED, ER, CCU, ICU, all of the medicine specialisms as well, you're giving yourself a really good chance of securing a great role in a great hospital. If you're interested in working in acute medicine, then please do get in touch. At the moment we've got roles particularly from ST3 plus level, so anything at senior registrar, specialty doctor and consultant level vacancies across the NHS, so from the very far south to the very far north of Scotland. Most trusts are calling out for doctors in that field, so please do get in touch and we'd be most happy to guide you through, give you some input on how to improve your CV for a career in acute medicine and obviously help you secure a role.